महेंद्र ऑल ओके, कोई प्रॉब्लम तो नहीं है? मतलब पहले नहीं था, स्टार्टिंग से स्टार्ट करना है। ओके ठीक है ओके। Okay, good evening everyone. I'll be starting the perio and the implant session. So the first question that we want to discuss is internal bevel incision as marked with number 2 in the image below will raise. So first of all, you need to understand what is internal bevel incision. It is the first incision that is given to give a horizontal incision. Internal bevel incision is given at some distance from the crest of marginal gingiva. So basically, when this incision is given, or this type of incision helps to differentiate the different types of flap surgery. So when an internal bevel incision is given, so this incision is given at some distance from crest of marginal gingiva, and based on this incision, the different types of flap surgery are planned. In a modified Widman flap and an apically displaced flap, internal bevel incision is given at a distance of 0.5 to 1 mm distance from the crest of marginal gingiva. In cases of undisplaced flap, it is given at a distance from base of the pocket basically. So in cases of undisplaced flap, basically when we are giving it at the base of the pocket, the complete pocket wall is removed. That is why undisplaced flap is a type of surgery that is a pocket elimination surgery in which the pocket is completely eliminated. But in case of apically displaced flap, what is done? In this, the internal bevel incision is given at a distance of 0.5 mm away from the crest of marginal gingiva, and the remaining pocket wall is apically displaced and sutured. So what happens? This remaining pocket wall converts into attached gingiva. So it is also a pocket elimination surgery, but the complete pocket wall is not eliminated because it is remaining pocket wall is apically displaced and sutured. So that remaining pocket wall will convert into attached gingiva. Okay, the next question is which of the amongst of the following are clinical features of ANAC? Okay, so let's rule out the wrong options. The first option is it occurred due to viral infections. We all know it is a bacterial infection, so this is wrong. Secondly, a bone loss is seen. So we all know that bone loss is seen. This is correct. The third is punched out crater like lesion. This is also correct. And fourth is recession. So this is wrong because you know ANAC is a necrotic disease, so no recession is seen in ANAC. So this is a wrong statement. So ideally answer 2 and option 2 and 3 are correct. So this is a multiple choice option, answer 2, and so our answer would be D here, 2 and 3. Okay, next question. The periodontal effects of smoking. Okay, to find out the answer for this, first let's understand the different effects that is seen in smoking. In smoking, first of all, uh, the amount of periodontal pathogens in deep pocket increases. There are increased cytokines. The cytokine will increase in number, but the fibroblast will decrease in number. The GCF flow will increase initially, so there is transient increase, then it will decrease. Their subgingival temperature is decreased in cases of smoking. Let's see now the options. The first option is GCF flow decreases. So this is not a completely correct option because the option ideally should be there is transient increase, then there is decrease in GCF. So let's see, but it is not 100% correct option. The second option is subgingival increase in temperature. So this is a wrong statement. We know the temperature decreases. The third option is increase in fibrinogen. This is wrong. We know the fibrinogen decreases. Option 4 is decrease in fibrinogen. This is correct. And option 5 is decrease in number of yellow complex bacteria. So what happens? The yellow complex bacteria will decrease, but the more advanced bacteria that are P intermedia, P gingivalis, this will increase. So the option 5 is also correct. So let's see if we have an option 4 and 5 that is correct. So yes, 4 and 5 is correct here. So we know first of all 2 and 3 are wrong. Okay, 100% for sure. Let's rule out options with 2 and 3. So A, B, C is 100% gone. Okay, so the answer here would be D. Next question is which among these are the clinical signs of traumatic occlusion? So in a traumatic occlusion, basically clinically he is asking, there is increased tooth mobility. So the clinical sign here is tooth mobility and the radiographic sign is pedial widening. So the option here would be, correct option here would be tooth mobility. What are the steps in osseous resective surgery? See, there are 4 steps in osseous resective surgery, in which the first 2 steps are known as steps of osteoplasty and the next 2 steps are known as steps of ostectomy. The first step is vertical grooving. The second step is radicular bending, in which the grooves are blended with a burr. The third step is flattening of the interproximal bone. And the fourth step is gradualizing of the marginal bone. So these are the 4 steps. Please remember them in sequence so that you can find the correct answer. So vertical grooving, radicular bending, flattening of the interproximal bone and gradualizing of marginal. Next question is, plateau-like bone defects is seen in, with bone margins are seen in which bone defect? So we all know it's a very simple and an old question. It is seen in ledges. So the answer here would be ledges. B ledges. Which of the following is not a universal curate? So I am not sure about the options because the options here are not complete. So I will tell you the different types of universal curate. Rounded toe 23 is a universal curate. Banhart's 1, 2, 5, 6 is a universal curate. Columbia 13, 14, 2R, 2L, 4R, 4L are universal curates. Langer 1 and 2, Indiana University 13, 14 is a universal curate. Now, if you see all the options, these 3 are universal curates. So, we don't know exactly what is the 4th option. So, just look at the options that are there in your questions, because the options that are being provided right now to me are all universal curates. Okay. So please remember the names: Banhart 1 and 2, 5, 6, Columbia 13, 14, Columbia 2R, 2L, 4R, 4L, Langer 1 and 2, Indiana University 13, 14, all are universal curates. Okay, next question. Which inflammatory markers increase in person with periodontal disease as compared to a person without any periodontal disease having cardiovascular disease? Okay, again the options are not recalled, but what he is asking right now, what are the common inflammatory markers for cardiovascular patients and periodontal disease? So please remember the etiological factor, the pathogenesis of periodontal disease and cardiovascular disease is quite similar, and markers like C-reactive protein is increased, fibrinogen is increased, interleukin 1 is increased, interleukin 6 is increased, tumor necrosis factor alpha is increased. Okay. Besides this, interleukin 1 alpha, 1 beta, interleukin 1 RA, all these factors are increased. Now interferon is not increased, so I can rule out this option very easily. Interleukin 4 is not increased, it is not increased. So out of these options, option 3 looks to be the best answer, but again it depends upon what options are there. So out of these options, both these all these factors are common in the cardiovascular patient and the periodontal disease. So out of these options, the answer is C here. Okay, the next question is, attachment of oral epithelium to an implant is by. So please remember, the oral epithelium attaches to the implant by hemidesmosome and basal lamina. So the answer here would be D, hemidesmosome and basal lamina. Please remember, in case of an implant, basal lamina converts into junctional epithelium. Like in a natural tooth, the confluence of reduced enamel epithelium and oral epithelium makes junctional epithelium. But in cases of an implant, basal lamina forms oral epithelium. So right now he has asked about the attachment of oral epithelium to implant is by. So answer here would be hemidesmosome and basal lamina. Next question. Not a clinical indicator of trauma from occlusion. Okay, so in trauma from occlusion, Fremitus test can be used. Yes, tooth wear is also an indicator. Tooth mobility is also an indicator. Now, decreased width of pedial space. No, in trauma from occlusion, the pedial width is increased. So this is a wrong answer. So answer here would be D. Next question, pocket in which lateral wall of pocket is present between tooth and bone. So when the pocket is present between tooth and bone, it means it is below the base of the gingiva, base of the sulcus. So it means the pocket is infrabony pocket, also known as intrabony pocket. So answer here would be D. Okay, next question. Which of the following will serve as an etiological factor for anak? So first of all, let's discuss about what are the different etiological factors of anak. So now if I tell you about anak, the etiological factors could be stress, could be anxiety, all those factors that leads to immunosuppression. Okay, that is an etiological factor. Malnutrition, viral infections, protozoal infections, all these factors can lead to anak. So if I now see the options, developed economies, no. Poverty, poor oral hygiene, poor living conditions can lead to anak. Malnutrition is an etiological factor. B is correct, not puberty, not pregnancy. So out of these options, option B is the correct answer here. Okay, so again it's a repeat question. Next question is an image based question. They've asked you what is this? Identify the instrument. So we know this is an explorer. The number here is 23 and 17. This is a 23 and this is a 17 number tip of an explorer. So please remember this is 23 and 17. Okay, there is one more image based question. They have asked you what are these defects. We know these are bone defects. So if you can see properly, the bone here is deficient on the buccal side. Here the marginal bone is also removed or also resolved. So this is a dehiscence. In the second side, we can see only there is a small window like defect. Marginal bone is intact. So this is a fenestration. So the answer here would be dehiscence and fenestration. Dehiscence and fenestration. Next is again an image based question. What is this? This is a file scaler. This is a file scaler. Remember this image? This is a file scaler. I'll show you how a hoe looks. Hoe looks like this. This is a hoe. File scalers, hoe, chisels are always used to remove subgingival calculus. They are always used to remove subgingival calculus. Okay. So this is a mini 5 Langer curate. So out of the options, the answer here would be that is file scaler. Okay. So this is a hoe. This is a mini 5 Langer curate. Next question, quantity of doxycycline and sub-antimicrobial dose doxycycline is very old question. We know it is known as periostat and the doses is 20 milligram. It is 20 milligram of doses. This is given twice daily. Okay, next is a very interesting question. The question is, adult patients present with broken crown fracture with respect to 1-4, post and core followed by PFM is planned. Prior to this, crown lengthening is done. Okay, now the next information they are giving is that the amount of keratinized gingiva on the buccal aspect of 1-4 is 2 millimeters only. What should be accomplished to do the crown lengthening? Okay, now first of all need to understand what are the different ways by which crown lengthening can be done. One is flap surgery, in which I cut a portion of a marginal gingiva and increase the length of the crown. Next is gingivectomy. I remove some portion of the gingiva. And third is periodontal flap surgery, but with repositioning, apical repositioning of gingiva. Okay. Now, if I do the so first information that I have to see is how much is the amount of tissue on the buccal side. He has given me information that the keratinized tissue is 2 mm. See, minimum amount of keratinized tissue that I need around my tooth is 2 mm. So if I do any of the procedures by which I cut this tissue to get the increased length of the crown, I'll lose all the amount of keratinized tissue that is there on the buccal side. So basically, I cannot do any of the procedures in which I can cut this and remove it. So basically, what I'll do is I'll shift it apically. I don't want to lose this. So what I'll preferably do here is apical positioning of this so that the length of the crown also increases and I do not lose the keratinized tissue. If this value would have been 5 mm, then I would have preferably done a gingivectomy. But if this length would have been 5 mm and plus it would have been mentioned that the bone architecture is also not correct, then I would have done a modified Widman flap. So 3 different types of questions you can get for this thing. Okay. The next question is laser used in osseous resection in periodontal surgery. Okay. So for osseous resection, first of all, the type of laser that we need is a hard tissue laser. So if I talk about a diode laser, it's a soft tissue laser. Out of these lasers, a CO2 laser and erbium chromium YSGG laser is a hard tissue laser. Now, if I choose a single best answer out of both of these, erbium chromium YSGG is a better option because both these lasers, they work on a principle in which the laser is absorbed intracellularly by water molecules. Now, this absorption capacity of the water molecules, intracellular water molecules, is better for ER/CR/YSGG laser. So, more the absorption of this laser by the water molecules, less would be the tissue damage. So, out of both these options, ER/CR/YSGG laser is a better option and better answer here. So, answer here would be D, ER/CR/YSGG laser. Okay, next question is which of the following 8 changes is seen in periodontal ligament? Let's see the options. First option is scalloping of alveolar bone and PDL. So again, not a complete option. Let's see, because the proper option is increased scalloping of alveolar bone. That is a correct answer. Anyhow, second option is decreased number of fibroblast cells. This is a correct answer. Decreased elastic fiber, wrong option. Increased elastic fiber, so this is wrong. D option, increased organic matrix production. This is wrong, then because the number of fibroblasts decreases, the organic production also decreases. This is wrong. So out of these options, the best answer here would be B, decreased number of fibroblast cells. Besides this, what you also see is there is decreased production of collagen fibers. The denaturation of the collagen decreases. So the total content of the collagen will increase. New production of collagen will decrease, but the total content of the collagen will increase because the denaturation of the collagen is decreased. So in this case, the option would be B, decreased number of elastic fibers. I'll just move on to the next question. Okay, next question is periodontal prognosis of a tooth with grade 2 or grade 3 furcation involvement with mobility, advanced bone loss and greater than 50 attachment loss. See, to decide this, the most important factor is attachment loss. So if I tell you the grading of prognosis, good prognosis when there is no attachment loss and everything is good. A fair prognosis is when at least 25% of the attachment loss and class 1 furcation. Poor is 50% attachment loss with class 2 furcation. Questionable is more than 50% of the attachment loss with class 2 or class 3. And hopeless is inadequate attachment loss. Right now the information we have is more than 50% of the attachment loss is there. So the best option and the answer here would be C, questionable prognosis. Okay, so fair is 25, poor is 50 and class 2. Questionable is more than 50, hopeless is significant inadequate bone support. Okay, next question. Initial colonizer complex of dental plaque. See, we all know there are 2 types. Initial colonizers are there, those are bacteria that initially attach to the tooth surface. So yellow and purple complex are initial colonizers, and green, orange, red, they are colonizers that occur later on. Those are known as secondary colonizers. So right now initial or primary colonizers are yellow and purple. Yellow is Staphylococcus aureus and purple is Actinomyces. So both these are initial colonizers and the answer here would be A. Next question. Which of the following is not a feature of localized juvenile periodontitis? So let's see the options and let's keep on ruling them out. First option is it is a degenerative disease. So this is the correct answer. Involves incisors and molars in localized form. Correct answer. Third option is occurs with equal frequency in males and females. Wrong. The frequency is more in females as compared to males. So this is a wrong option. So this is wrong. D, rapid periodontal bone destruction compared to normal. This is correct. So out of all these options, if I rule out one correct answer, that is C. So answer here would be occurs with equal frequency in males and females. So this is how you have to approach your questions. Try to find out the wrong option out of all the options. Okay, so the next question is cyclosporine associated gingival hyperplasia most frequently involved. See, please remember any drug induced in hyperplasia, labial surface of anteriors is most importantly involved. So out of these options, C is the best answer because he has asked about cyclosporine induced enlargement. That is due to increase in number of plasma cells basically, and the answer here would be C, and labial surface of anteriors. Okay, next question. Which of the following will be seen in patients with loss of interdental bone, okay, and including facial and lingual traits? Interdentally, both the facial and lingual traits are resolved with no loss of radicular bone. So basically, he's saying that the interdental bone is resolved, but interradicular bone is not resolved. So we know it. This is known as a negative architecture or a reverse architecture. Because in a positive or an ideal architecture, the interdental bone is higher and the interradicular bone is lower. But in this case, we have seen that the interdental bone is lower and the interradicular bone is normally present. So this is an example of reverse or a negative architecture. Okay, identify the suturing technique. So the option was, picture was of figure of 8. So I'll show you how a figure of 8 is given. I'll just draw it here. So when you want to see a figure of 8, suppose this is a buccal side and this is the lingual side. So the needle will pass from outer of buccal and then the needle will not pierce any of the flaps. Then the needle will pierce the outer of lingual and then the needle will come on the buccal side and you'll give a knot. So outer of buccal is the first pierce and the second pierce is outer of lingual. So when you get any picture like this, this is known as figure of 8. Okay. So they have asked about figure of 8. I'm sorry, they have asked about figure of 8. So this is how the picture should look. So what they have given here, the picture of figure of 8 is wrong. This is not a figure of 8. This is a crisscross suture, a type of horizontal mattress suture. So please remember this picture is wrong. I have deliberately put this picture to make sure you understand. This is not figure of 8 because it looks like an 8. This does not look like a 8. This is a crisscross horizontal mattress suture. This is not figure of 8. The figure of 8 looks something like what I have told you in the what I have drawn. Okay. Next question. During menstrual cycle, all changes are seen in gingiva except. So during menstrual cycle, number 1, bleeding gums because vascularity increases. Option A is correct. Option 2, increase in exudative fluids from inflamed gingiva. This is also correct. Tooth mobility changes significantly. No, tooth mobility does not change. This is wrong. Salivary bacterial count is increased. This is also correct because the steroidal hormone is increases. So the best answer to choose out of this is option C. Okay. Next question is microorganism significantly increased in pregnancy gingivitis. See, in pregnancy gingivitis, because we know that the steroidal hormone increases, the prevotella intermedia increases because prevotella intermedia depends on the host cells for the steroidal hormones for its growth, which is increased in cases of pregnancy. So the answer here would be B, that is prevotella intermedia. Okay, next question. Bacterial plaque mainly consists of option A, bacteria, bacterial products. Option B, food debris, no. Option C, components of saliva. Option D, components of GCA. So please remember, plaque has maximum number of bacteria and bacterial products. 80 to 90% is this. So C and D is also partially correct, but the question is chiefly consists of. So the option here would be A. Next question, function of water rain device. So they are asking about the water picks or the water flossers. What are their function? So first option is they remove subgingival plaque. So please remember, all these water pick devices remove unadherent plaque. They cannot remove adherent plaque to the tooth surface. So this is wrong. Second option is remove non-adherent plaque and debris. This is correct. Third option is remove subgingival plaque. Again, the option is repeat. So answer here would be B, that is remove non-adherent bacteria and debris. Okay, next question is critical probing depth. So please remember, critical probing depth is ideally the depth it is ideally the depth. Suppose if I talk about scaling, this critical probing depth concept was given by Linde, and according to him, if we do a scaling in patients who have less than 2.9 mm of probing depth, it will lead to further attachment loss. So this is critical probing depth. Only in patients with more than 2.9 mm of probing depth, you need to do a scaling and root planning. Otherwise, it can lead to attachment loss. Similarly, if he talks about critical probing depth of flap surgery, the answer is 4.2. Ideally, the flap surgery should only be done when the critical probing depth for in that area is more than 4.2. If it is done in cases less than 4.2 mm, it can lead to further attachment loss. So this answer here would be 2.9 mm. If we specifically ask about surgery, then 4.2 mm. Next question. Okay, first we need to understand these four definitions. Very, very important. What is a risk indicator? He can give you this definition and can ask you what is this. A risk indicator basically is a risk factor that is identified by cross-sectional studies but not confirmed by longitudinal studies. Please remember the definition word by word. They ask you specifically by giving the definition. Risk predictor and marker are the same things. They are associated with increased risk of the disease, but they do not cause the disease. Risk determinant or background characteristic, one in the same name, are the factors that cannot be modified. And relative risk are basically the ratio of the risk of the disease in exposed group to the people to the unexposed group. मतलब कितना हो सकता है in the exposed group as compared to non-exposed group. So right now he has asked about which cannot be modified. So we know that is risk determinant or background characteristic. That is option A would be the answer. Okay, we have done this. Okay, this question. False about after 5 curates. So please remember, after 5 curates are a modification of Gracie curates. So option A is correct. Please remember, after 5 curates are basically 10% thinner. They are 10% thinner as compared to Gracie curates, and they have an elongated shank for an easy access. Okay, so the option 2 is they have thin blade for smooth insertion and a elongated and a tapered shank. This is correct. All third option is all Gracie numbers are available in after 5 series. This is wrong because we know hash 910 is not available. जो भी Gracie curates है उसमें hash 910 is not available in after 5 curates. So this is wrong. Last option is for removing heavy and tenacious calculus after rigid after 5 curates are used. This is correct. So the correct answer here would be option C. Okay. Next option is predominant immune cells in subgingival gingivitis. We all know in subgingival gingivitis, neutrophils is 90%, the maximum number. So the answer here would be A, PMNs. Next question, very, very important. I had been behind this question. I've been telling people that this question can come any day. Very important. GEM21S consists of, please remember, this is a growth factor which is a combination of recombinant platelet derived growth factor and beta tricalcium phosphate. So it is a combination of two things, that is recombinant platelet derived growth factor and beta tricalcium phosphate. The answer here would be C. Okay, and the last question is, what laser is recommended for use in new attachment procedures? So please remember, for new attachment procedures, NDYAG laser is preferred. That helps in attachment of new attachment of the oral epithelium to the tooth structure. So answer here would be NDYAG laser. Okay. So thank you so much. Discuss some of the important questions. By ruling out method, please make sure whenever you are solving any MCQ, whether it's your test series, whether it's your exam, follow this principle and just apply it. It will help you a lot. Okay. So thank you so much. And